Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us today. Our guest is Dr. Anand Murthy, here with us as a shoulder and elbow surgery expert, specializing in throwing injuries, shoulder surgery, as I said, and elbow surgery. Welcome to the program, Dr. Murthy.
Great. Thank you very much for having me.
Now, you're there at MedStar Union Memorial Hospital. Where exactly is that located?
That's a little north of the city, right by Johns Hopkins undergrad, a large footprint right there.
You're an orthopedic surgeon, and you specialize not only in elbow surgery, but shoulder replacement, reverse shoulder replacement, and things of that nature. But we're here today to focus on elbow surgery. What is it about the elbow that makes it a little bit more problematic sometimes than some of the other surgeries that you may be involved in?
The elbow joint is very complex. It has a lot of bony issues that can occur. It's a very hinge type of joint. And when the injuries occur, such as in a throwing athlete or a pitcher, and they can disrupt this ligament, it's very hard for it to heal on its own due to the repetitive nature of throwing. And then often we have to reconstruct that ligament. There are multiple nerves that cross the elbow joint that have to be protected and taken care of. So it's a very complex joint that we work on.
You mentioned tearing ligaments due to repetitive pitching sports. When the bone is actually broken, is that even more problematic, or are, the tearing of ligaments and the breaking of a bone pretty much equal as far as the difficulty in making those repairs?
Interestingly enough, when a patient fractures their elbow, it's often easier to repair that. Bones heal very easily, especially in young patients. It's a good vascular supply, and those bones heal easily. When ligaments tear, it's usually a chronic issue. It's very difficult to get those patients back with just rehabilitation or conservative treatment. So ligaments healing when they tear are much more difficult than bones.
Are there several types of breaks in the elbow itself? I mean, the elbow is very small. How many different types of breaks can you actually get there?
Oh, you can actually have multiple. You can fracture the end of your arm bone. That's called a distal humerus fracture. Mm-hmm. You can fracture the radial head. That's the circular bone that allows your arm to rotate. And there's also what's called the ulna or the olecranon, which is the back of the elbow or the forearm, and that often breaks. It's attached to your triceps tendon. Mm-hmm. But when people fall, they usually commonly break their olecranon.
Are these isolated breaks, or can they be a combination based on the trauma that the elbow endures?
It's definitely related to the trauma. A simple fall, they usually break one bone, but when they have a high energy or a traumatic injury or a motor vehicle accident or a fall from height, they can often break multiple bones and dislocate the elbow, too, all at once.
Now, is surgery always a requirement when it comes to a bone fracture or even a severe ligament tear?
No. Most commonly, if the fractures are well aligned and they haven't displaced, which means they've moved out of alignment, then those patients can usually be treated with a short period of immobilization and then therapy, and they usually do very well. Same with ligaments. It really depends on how much they've moved or displaced or away from their normal alignment. That depends on whether they need surgery or not.
Are these non-surgical options something that can be performed, pretty readily by a non-specialist, or is it usually advised to seek out a specialist when you sustain such an injury?
My thought is, to always seek out a specialist with the elbow. It's a very complex joint. And before you can treat it, you have to have the right diagnosis. And maybe that's probably even more important to understand that the diagnosis of some of these even common injuries can usually be done very well by a specialist who specializes in the elbow or the shoulder or whatever joint you're seeking care for.
Do you ever find yourself working with someone who sustained an injury, a small fracture, and it healed on its own without coming to see a specialist? But now they're having problems 10, 15 years later, and those problems are persisting to the point where they actually have to have surgery to repair or relieve the discomfort.
Oh, sure. We usually term that a post-traumatic arthritis or post-traumatic malunion, which means they had a fracture or an injury, which they treated, with bracing or rehab, and it wasn't aligned properly or functionally in the right way. And they go on over, 5, 10 years, they'll develop stiffness in the elbow or contractures or actually arthritic joints, at which point, the surgery then is needed. It's a little bit more complex, whether it's an arthroscopy to clean out the elbow or replacement of the elbow or realignment of the elbow. Those become much more complex when you're taking care of them later on.
In the case of complex trauma, would you treat the shoulder or the elbow first based on how you want your patient to regain mobility?
So if a patient comes in with multi-trauma in the shoulder and elbow, we usually fix both at the same time, especially in the upper extremity, because the key is to start mobilizing them or to start moving that extremity. When anyone has a fracture of both the shoulder and the elbow, those joints become very stiff if not treated and then moved really quickly. So if you repair them or don't treat them, it's very difficult to get ahead of the game and get their motion back if you don't treat both of them at the same time.
Oh, now, is this something that you went into deliberately, or did something happen in the course of your medical training that steered you toward this area of expertise?
Where I trained, my mentor, my chairman, was a world-renowned shoulder surgeon, shoulder and elbow specialist. So he really mentored me and guided me down this pathway. And then I did that fellowship in shoulder and elbow surgery under another well-renowned, surgeon up in New York. And I enjoyed the surgery. I enjoyed those types of patients, type of pathology, those kind of diagnoses, injuries. And they do well. I get to take care of patients from pediatrics all the way up to grandmothers and grandfathers, and it's a great experience.
Now, we'd like to learn some more about MedStar. Where can we get some more information?
Well, MedStar, you can go online. That's medstar.org, or Union Memorial Hospital as well. Those websites are available, and there's some really good information on all our specialties and all the physicians and, physician extenders that work there. And there's a lot of information online as well.
Dr. Murthy, thank you so much for taking the time and joining us here today.
Great, thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of the program are available at hpr.fm. Also at healthprofessionalradio.com.au. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. Be sure and visit our affiliates page at hpr.fm.